Okay, welcome, Healthy Back Institute. I am here with my friend and colleague, Dr. David Hanscom. Dr. Hanscom is a pioneer in helping people with metabolic inflammatory disease and chronic pain, and from an educational standpoint. And one of the topics that Doc has pioneered is called repetitive unpleasant thoughts. I know some of you out there have definitely had repetitive unpleasant thoughts. And Doc, I'm just going to go ahead and talk about ruts, because if you're stuck in a rut out there and you're in pain, this is a solution for you.
Well, let me give you a little bit of background here. So I'm a spine surgeon, and people go, well, what do you do and talk about repetitive unpleasant thoughts? Well, it turns out spine surgery is being a little stressful, and we push really hard. And what we tend to do, we tend to suppress stress. We don't complain very much. We push hard. We work way too hard. And I think the system in general takes advantage of us, but we sort of choose to do that when we go into medicine. And my thing in high school, I was just really tough. My nickname was the Brick. And I went through college, taking 18-hour class loads, working 20 hours a week in construction work and never stopped. Medical school, same thing. Residency, fellowship, went to one of the top fellowships in the world. I just started knowing these sort of screwy thought patterns and just got worse and worse and worse. Then when my son was born in 1984, everything got worse. And it tends to be sort of common that major life family events are an issue, really setting things off. So I developed these repetitive thoughts that eventually evolved into full-blown obsessive compulsive disorder, which is manifested by severe intrusive thoughts. And about 3 to 4% of the population has a full-blown diagnosable OCD, obsessive compulsive disorder. And I didn't really think I had it, because you think about hand washing and all sorts of stuff. These things become very vivid. They start coming at you like horseflies on a horse. They just don't stop.
Yeah.
And I was miserable. So I didn't know what to do. And it was unbelievably difficult. I'll tell you now, over the last, I would say, 20 years, 2003, I came out of it, and I've been fine ever since. And I've helped dozens of other people out of it. So I want to back up just for a second. So what is a repetitive intrusive thought or repetitive unpleasant thought? Turns out there's tons of research on this. This is a very widely researched area that doesn't seem to have hit clinical medicine very well. I think that almost everybody has some level of unpleasant thoughts that just are more frequent than they like to admit. I do not like psychological diagnosis. It turns out, we'll talk about this later, that every chronic disease, mental and physical, has the same root cause of what we call threat physiology. What I mean by that is that when you're under any type of perceived danger, real or perceived, it doesn't matter. I'm going to call that a threat, that your body responds with physiology to help you survive. A parked car has no symptoms, but you turn the car on and it's going to have symptoms of the things that are not working correctly or things not in balance.
I just want to pause for 1 second, because I want our audience to understand that around threat physiology, that, my kid's high school graduation, that can be perceived by the body as danger or threat, and can have the same physiological response as, getting in a car accident. Is that correct?
Right. If a dog jumps out and tries to attack you, of course, you go into fight or flight. That's a physical threat. But it turns out that unpleasant thoughts, create the same threat response as a physical threat. They go to similar parts of the brain. So again, just to define terms, physiology is how the body runs. Is your total body response to perceived danger. Danger, real or perceived, it doesn't matter. And it's just an alarm signal. So that physiological response, we call threat physiology or fight or flight, is a bunch of things happen. Your stress hormones go up, like adrenaline and cortisol, but your neurotransmitters go from calming to excitatory neurotransmitters called glutamate. So your neurotransmitters change. Then your body's inflammatory response goes up in the form of cytokines. And there's all sorts of inflammatory molecules in the body, but a lot of them are actually in your brain. Half your brain is what's called glial cells, which are the supporting structures of the brain, and they become inflamed. Your brain gets inflamed. And then your metabolism goes up, a hormone called cortisol that fires up, and it starts pulling fuel from every cell in your body, including your nervous system. So you start consuming fuel, your neurotransmitters change, your inflammatory response goes up, and your body's in a full fight or flight response. And remember, our first biological imperative as humans is to stay alive.
Yeah.
The second imperative is to pass your genes on to the next generation. So I have a model called dynamic healing. We look at the input of the stresses or your circumstances, and your body's always surveying everything every second for safety or danger. You have your nervous system, through different sensory receptors, receives the signals. Then it sends out signals in the forms of all these things we talked about into threat or safety physiology. So safety physiology is the opposite, which is oxytocin, anti-inflammatory cytokines, common neurotransmitters. Fuel goes back into your cells. You're storing energy to fight another day. So the just simply states of staying alive is either safety or threat. The key issue here is that physiological response is 1,000,000 times stronger than your conscious brain. We process about 40 million bits of information per second. The conscious brain processes about 40.
So basically, in the background, my physiology is consuming way more energy. And I just want to go back to the points that you talked about. The body's using its resources to, sustain during this threat physiology. So it makes sense why someone who's in chronic pain or chronically emotionally challenged, they're going to be more tired. Because all these symptoms, people come in, they're like, I can't think clearly, or I'm always tired. But you're breaking it down into such a simple perspective that they're stuck in a chronic state of threat physiology.
Right. That's the essence of all chronic disease, is sustained threat physiology. So you're right. Brain fog comes from the inflammation of the brain. It's not functioning correctly. Irritable bowel, spastic bladder, skin rashes, etc., come from what's called mast cell activation. And mast cells are inflammatory cells that are like scatter bombs. And so any surface that's in contact with the outside, which includes the bowel, the mast cells put out very highly inflammatory molecules. And so your bowel becomes leaky, the bladder becomes irritable, skin rashes pop up, etc. So that's, again, one symptom. So I was in chronic pain, or I use the word chronic disease state, from 1999 to 2003. If you go back to my life, it's been there off and on my entire lifetime. And everybody has some of these symptoms. And at some tipping point, they become bothersome to the point they interfere with function. But it turns out, again, there's the input, the nervous system, and the output. So just to define terms, thoughts are on similar circuits in the brain as physical pain. So a dog jumps out at me, I withdraw, or touch a hot stove, my hand withdraws.
Yeah.
But with mental pain, there's no withdrawal response. So unpleasant thoughts are also perceived threat. It creates the same real physiological response that translates into symptoms. I'll talk about the symptoms in a second. Then what happens with thoughts, which is deadly, if you suppress the thoughts, they become even stronger. They actually fire up the brain even more. There's a whole bunch of research on thought suppression. There's higher opioid addiction. Different parts of your brain actually shrink. It just has a very direct physiological effect. So at the end of the day, circumstances translate into physiology, translate into symptoms. The thoughts are the psyche, but the symptoms are physiological. This is not imaginary. Your body's responding to perceived threat. And in medicine, we're treating symptoms, but we're not acknowledging people's stresses. We don't know their coping skills in the nervous system. And we're not addressing the physiology. We're treating only symptoms.
There's so many variables as we go back into treating this, how people handle stress is dependent upon their family, how to repair emotional problems, or how to respond to stressors. So I'm a trained chiropractor and, put everything on, the health of the nervous system and the spine, but it goes even deeper into the psyche and how it connects to the physiology. So it's functioning as one. Yet modern medicine, allopathic medicine, typically is just saying, okay, we're going to look just at the end point of this response. It's symptoms only, and we're falling short. It's obvious by the statistics that are out there today and opioid crisis.
So the essence of all chronic disease, mental and physical, is sustained threat physiology. Your body just breaks down. You have to be in one or the other, safety or threat, or somewhere in between. So there's always some level of threat physiology in place. I mean, here's the kicker. This is not new news. I didn't invent it. My process just hangs out research in a way that people can access it. It's not magic. I didn't make it up. It's not about believing David Hanscom or what I put together. It's about actually connecting to your body's capacity to heal. So medicine right now has completely missed the boat. So the way you heal, if the problem is sustained threat physiology, then the answer is minimizing that and maximizing safety. So I talk about becoming a professional at living your life. There's ways of processing this survival response, which is a gift. And there's ways of inducing safety, or we call it cues of safety. And it's all self-directed. It's very simple. And 90% of all symptoms in the body are based on your body's function. I mean, we actually learned this in high school.
Yeah.
Right? In physiology class or science class, we learned about fight or flight. We learned about cortisol. We learned about stress hormones. And somehow medicine has gone down the rabbit hole of everything being structural.
Yeah.
Very little of it structural. I mean, a broken bone structural, of course, or a tumor structural. but it's how the body functions that creates symptoms.
I want this audience to understand that the whole first portion of your medical life was all based on structure.
So I'm somebody who's been on both sides of this fence. I was doing major spine surgery aggressively. I actually felt badly if I could not find a reason to operate. That was the end of the line. People tried everything. Surgery is a definitive answer. So we do lots of fusions for low back pain. Turns out we were doing fusions on normally aging spines. Disc degeneration has been, as you well know, has been documented to not be a source of pain.
Yeah.
Here. We know for acute pain, of course, disc can be an issue, but in general, chronic pain does not come from the disc. So we're operating on a documented normal aging spine. The success rate for a spine surgery for back pain, low back pain, is about 20 to 25%.
And by success rate, you're meaning symptoms gone.
Right. These are big operations.
Yeah, I know. And only 22% are actually getting relief from the pain that they came to you for.
But here's where it gets worse. And I did not know this until after I quit my practice, but there's a bunch of papers out there that show that actually, if you operate in the presence of untreated chronic pain, doesn't matter which part of the body you're talking about, gallbladders, hernia, breast biopsies, back surgery. Let's say you do a hernia repair, you have untreated chronic pain, that you can induce chronic pain at the hernia site. No prior pain there before. It's a very simple operation. Generally, should not have pain. So in the presence of untreated chronic pain, you can induce chronic pain at the surgical site 40 to 60% of the time. And around 5 to 10% of the time, it becomes permanent. So if I had a neurological complication rate of 5 to 10%, I would not have been in practice. That's unacceptable. In some ways, chronic pain is worse than a cut nerve because there's no endpoint.
Right. There's no structure.
Right. So so you have ongoing severe, miserable pain, and there's no endpoint. The doctors are telling you, well, there's a term called MUS, medically unexplained symptoms, which means we know you have pain, we feel badly for you, but have a good life. And so you're in this miserable experience. You're totally trapped. Nobody's helping you out. We're doing procedures on you that have been documented to make you worse. You do any procedure in any part of the body in the presence of chronic pain, there's a 40 to 60% chance of making it worse. Even a simple epidural injection, I've seen this happen all the time, makes people worse. And I didn't understand why until I saw these papers after I quit practice, well documented that you start doing procedures in the presence of untreated chronic pain. Remember, it's a neurological disorder. Your brain's fired up, your body's in fight or flight. So anything you do that adds more stress to your body, i.e. any procedure, fires up even more.
Untreated chronic pain, you're talking about treating it from a threat versus safety physiology.
Correct.
And I don't want to throw you off because I know you have some things that you want to talk about with RUTs. And I just want to make sure we get into this. If there's any quick tips, there's a ton of things you can do to take your threat physiology down, but what can we do to bring our safety physiology up?
Well, it goes both ways. We tend to fight the darkness. And my point is just turn on the lights.
I love it. It sounds like philosophy.
Right. So the dynamic healing model, there's ways of processing your stresses. You can increase the resilience of your nervous system with sleep, diet, exercise, and sometimes trauma therapy. With physiology, you can directly lower it with breath work. You can hum, massage your forehead. There's certain pitches of music that directly lower the physiology. And on the input side, there is two things. What are you loading into it? And what are you holding on to? So one of the basic rules of treating chronic pain is you don't complain about your pain. You don't discuss your pain or medical care. No complaining, gossiping.
The biggest thing that I heard in practice was my low back is killing me. And I'm like, that's exactly right, because you're saying that over and over. So it is killing you.
Right. So programming is a big deal. So the question is, what are you loading into it? And then the other thing is, what are you holding on to? And it turned out that forgiveness is a massively huge issue because the research shows that 90% of people in chronic pain are holding on to the original situation that caused the problem. Now, I want to back way up today. So people look at me as a back surgeon. This is chronic pain. But the bigger problem by far and away, and I learned this myself, because again, I had a panic attack in 1990. I had crippling anxiety for 15 years. The worst part of the pain is the mental pain. So I'm a back surgeon, but this is about chronic disease. This is not about pain. So I had so let me just talk about the symptoms you get. So you're in a fight or flight physiology, neurotransmitters are excitatory, you're consuming fuel, all sorts of things happen. I had 17 different symptoms. So first of all, I want to go into the mental part of this because this is really critical. I developed a major spine surgeon. I got there by suppressing stress. I was going 1,000 miles an hour. So it turns out that anxiety is the word we use to describe how you are in fight or flight physiology. It's a description of your survival state.
Yeah.
I don't know how that became a psychological diagnosis because it describes your fight or flight physiology.
Right.
As a result of stress, it's not the cause. It is not a psychological diagnosis. It's just a description. And every living creature survives by avoiding the sensation that humans call anxiety. The problem is if we treat anxiety psychologically, that response is a million times stronger than your conscious brain. So talk therapy actually is completely not helpful. And we'll talk about these RUTs in a second, which are repetitive, unpleasant thoughts. So the way you have physiology elevated, and again, I'll just jump right to really quickly. I put together, my book, Back in Control. I think this will be in the show notes. I have a resource called Direct Your Own Care Journey, which again it's called Dynamic Healing. There's ways of processing input. You can increase the resiliency of your nervous system, and you can lower the physiology, and they become automatic. This is not hard to do. It becomes just the way you live your life. So it's actually not hard. So it's complex, but at the end of the day, you're just trying to lower threat physiology.
Yeah.
There's at least 50 different ways to do that, maybe more. I'll tell people, look, it's a 1,000,000-to-1 ratio. Your anxiety, by the way, if you can't solve anxiety, you put in more of a stress response, you become angry.
Yep.
Anxiety and anger are the same entity. So your inability to escape something causing anxiety creates threat physiology. And when you can't escape it, you crank it up and become angry. So all sorts of stresses we can't escape. Remember, the most stressful stress is the stress that you can't escape. Maybe finances, maybe lack of opportunity, chronic pain, if you're trapped in that. So when you're trapped, you get really, really fired up. But every chronic disease has a common root cause, clear down to the DNA level and the mitochondrial level at the cellular level, that Parkinson's, dementia, cardiac disease, peripheral vascular disease, hypertension, obesity, cancer, autoimmune disorders, every chronic disease is the same root cause of sustained stress physiology. So I had migraine headaches, my ears were ringing, my feet were burning, skin rashes were popping up all over my body, my stomach was a mess, I had back pain, neck pain. But the worst part of it was the anxiety. And I thought it was psychological. I went to psychotherapy for 13 solid years. That's a lot. That's a lot of psychotherapy. And it got worse, way worse.
Yeah.
So I'm seeing multiple doctors. Nobody could tell me what was going on. And by the way, in the middle of this whole thing in 2009, I developed esophageal cancer that I got picked up by accident. I got extremely lucky to be here. So again, cancer has been well documented to be related to stress. And people think that stress is a psychological construct, most everybody, including myself, but it's not. Your body's responding to perceived or real danger.
Yeah.
The stresses are your threats. And your body's response is, again, we're going to get rid of the word anxiety and anger. You have activated threat physiology, then you have hyperactivated threat physiology. Now, the reason I went into this detail, because these thoughts, again, this is a physiological process. Thoughts are input, your emotions are what you feel. So you look at sensory input with unpleasant thoughts, and you experience them, and your body's in threat physiology. So as the threat physiology causing the symptoms, and so the thoughts are the input, but the symptoms result from the threat physiology.
Yeah.
And what we do, again, with physical pain, there's a nociceptive withdrawal response. You automatically withdraw your hand. Pain resolves. It's a danger signal. Anxiety is just a danger signal. Avoiding that sensation drives all animal behavior, including humans. There's a driving force, again, it's a million times stronger than your conscious brain. So you have this unpleasant thought, you go into some level of threat physiology, then you suppress the thought, it gets even worse. We all know when you try not to think about something, you think about it more. So the thing that drives the thought pattern is the need for mental control. Because remember, emotional pain and physical pain are processed in similar parts of the brain, and it hurts. You hurt my feelings, you broke my heart. And for me personally, the mental pain in the form of OCD was a nightmare. I thought I was done. I've been really clear with the world. I was actively suicidal in 2002. I barely made my way through it. I have 20 medical colleagues that are dead from suicide. Suicide in medicine is a big problem.
Yeah.
It turns out that the people that are most prone to this process of these unpleasant thoughts are high-level professionals. So let's go into the mechanics of repetitive unpleasant thoughts. So the problem is you have sustained unpleasant thoughts. And I don't like the term OCD. And honestly, if 3 to 4% of the population has OCD, that's a lot. That's a lot of people.
Yeah.
When I talk to people, especially people in their teens and 20s, but I think it's every age group, people don't want to talk about these thoughts. Everybody has them. So here's the deal. It's a human condition, this inability to escape her thoughts. And my cat has a fight or flight physiology, but if a dog threatens her, and the dog goes away, she lays down and goes to sleep.
Yeah. She recovers very quickly. It's even like a deer gets mouthed by a tiger.
Right.
It doesn't get eaten, but that it goes through its whole shaking physiology, heal, and then it goes right back to normal.
Right, because they don't have thoughts, they don't have a memory like adults do. So if I think about my mother who abused me, which by the way she did, I had a really tough childhood.
Sorry for that.
I can remain a victim of my mother's abuse, but she might as well be sitting right here.
Have you gone through, and I know you don't like the word forgiveness because you said it was a long word, but it's, we all kind of know what that is. Have you forgiven your mother for that?
No. So I don't like the word forgiveness, as you well know.
Yeah.
It's too big of a word. So let me go into the outline of how do you solve these things. Okay, so if you experience the thoughts, it's a problem. If you suppress them, it's a problem even more. So it's like spinning a basketball on your finger. If you think about the thoughts, you're spinning the basketball. If you try not to think about the thoughts, you're spinning the basketball even faster. What you have to do, there's two parts of healing. One of them is I call the sequence of healing: connection, confidence, and creativity. I'll go into that in a second. But you have this fight or flight physiology, anxiety and anger that are gifts. If we didn't have anger and anxiety, we'd not be alive. They're keeping us alive. They're doing their job. And we tend to feel ashamed, guilty, all these unpleasant words we use. But they're supposed to be incredibly unpleasant because they're survival sensations. The species of creatures who didn't pay attention to these cues just didn't survive. So these danger signals had to be loud enough that you were compelled to pay attention. So they're a million times stronger than your conscious brain. Mind over matter doesn't work. Doing battle with them makes it even worse. Suppressing them makes it even worse. So what do?
I'm going to just say acceptance.
No, I don't like that word either.
All right.
Okay, it's a survival sensation. There's danger. You don't accept anxiety and anger. You won't actually. So the way, okay, let me ask you a rhetorical question.
We can't suppress it because that makes it worse, you said. Okay.
So here's the question. It's a rhetorical question, which is not intended to be answered, but anxiety and anger are massive survival reactions, a million times stronger than your conscious brain. So how do you lower anxiety and anger? And the answer is you simply lower threat physiology.
Through things like breath work, tapping.
Right. You can process the input differently. You can increase the resiliency of your nervous system. You can calm down the physiology. But what doesn't work is talk therapy or positive thinking. It suppresses things.
To me, that seems like it perpetuates the same cycle that's there. You're just like talking about your thoughts, which is almost a form of suppressing them.
There's 4 steps to healing. The first one is thought diversion. The second is calming down the nervous system. The third is actually moving into creative circuits, away from the circuits. And the fourth one is dissolution of the ego. What we do, almost all of us, is sort of been taught that self-esteem is something to be desired.
Right.
This is a judgment pattern. You're always comparing yourself. There's no endpoint to it.
Yeah.
So this pursuit of having self-esteem is fine, or being happy is fine. But if you're trying to pursue self-esteem as a means of compensating for these survival circuits, you're in deep trouble because it's a 1,000,000-to-1 ratio. It's a mismatch. It's a judgment pattern that never allows you to be okay with yourself. First of all, it's a mismatch. It's impossible. Second of all, it fires up these thought patterns even more. So there's 4 parts to it. I'm going to use the metaphor of a popcorn machine as the metaphor. That the thoughts are the kernels of corn. The cooker is your nervous system. Then you have where you collect the obsessive thoughts with these pop kernels of corn. So the 4 parts of healing is number 1, to divert the thoughts. You can't divert them all, but you can divert the thoughts so they don't hit the cooker. So that involves called expressive writing. We simply write down your unpleasant thoughts, any thoughts, but unpleasant thoughts particularly, and you instantly tear up the piece of paper. We call it expressive writing. So it's just a separation exercise. You can't control your thoughts, but you can separate from them. So the thoughts are on the table, you're here. You tear up the piece of paper not to get rid of the thoughts because there's trillions and trillions, maybe quadrillions of thoughts. But just a separation, the thoughts are here, you're here. You rip them up to write with absolute freedom, but also to not analyze them.
Yeah, you're just brain dumping or thought dumping on paper, tearing it up.
It's not a catharsis. It's just a separation exercise.
Got it.
The second part is, okay, you're diverting thoughts. You can also do that with mindfulness. You go from racing thoughts to simple, just drop your shoulders down, sit in the chair. So you just go to different sensations. So you simply switch sensory input. I call it active meditation, which is a form of mindfulness. The third thing is called cognitive behavioral therapy, where you start reframing your thoughts. So you recognize thoughts as a cognitive distortion. And by the way, self-esteem is a major cognitive distortion. And cognitive distortions are defined by Dr. David Burns, but also other cognitive therapists. So most of our self-esteem is built on things like labeling, should thinking. We minimize the positive, maximize the negative. We catastrophize. Perfectionism is a cognitive distortion. They're all stories.
I'm thinking that right now it brings up the thought that social media is not necessarily helping us.
It's a disaster.
Yeah.
It's a disaster because everybody looks really happy, whatever, on paper or on the screen.
Yeah, of course.
We heard the term FOMO, of course, fear of missing out. And so that's part of the problem, that we always feel badly about ourselves because we're not doing this, or this. But also we're just being sensory overloaded. As one of my mentors pointed out, we're simply not programmed evolutionary-wise to process this much information per day. Not even close.
Yeah.
The thing about somebody 500 years ago, sitting in the prairie, waiting for the prey or waiting for dinner, hours and hours of sitting there waiting, watching. That's
right. They weren't scrolling. They were just sitting.
They weren't.
Yeah.
Right, exactly.
Yeah.
So the first step is thought diversion. Again, cognitive restructuring, mindfulness, expressive writing are the starting points. And you have to do the expressive writing. There's no shortcuts. It's the only part of the healing process that's absolutely mandatory. The same thing is the heat, turn down the anger. You talk about the word forgiveness. And it turns out people, and I thought the same thing, forgiveness is great. I'm not against forgiveness, but it's a big word. And people start thinking, well, if I just forgive so-and-so and so-and-so and so-and-so, I'm going to feel better. It helps. But there's endless things to forgive. It happens. We go into the victim mode every day.
Yeah.
Remember, the sequence of anger is circumstance, blame, victim, and angry. It can be real victimhood or perceived. By the way, being in chronic pain is real victimhood. But we're mostly victim of our thoughts in the form of perfectionism.
Yeah.
Self-critical voice. And so we're always, perfect isn't sustainable or even exist. So always a victim of less than perfect. We're always frustrated because we're less than perfect. And Dr. Burns pointed out the difference between your reality and your degree of perfectionism is the degree of your unhappiness. So the self-critical voice is one of the major driving forces of threat physiology. So again, with your thoughts, you're thinking all these cognitive distortions, you're driving your physiology. And so the way I call it anger processing, remember we talked about the way you solve anxiety and anger, simply lower threat physiology. So forgiveness is input, by the way. We have a little exercise called flip the switch, where we simply, I'm in a victim mode. It's powerful. It's addicting. I can't control it. It's automatic, hardwired. You realize, my mother really treated me badly. People do hold on to this calmly for their entire life, or they hold on to a sibling abusing them or whatever it is. And there's legitimate reasons to remain angry. But first of all, it keeps you in fight or flight physiology. That's a disaster. Second of all, then Dr. Luskin wrote a book called Forgive for Good. He and I are good friends. And we go into victim mode every day. So somebody cuts you off in traffic, somebody cheats you, whatever it is, it happens every day.
And that increases our threat physiology. I want to be conscious of time, because the last piece you talked about was dissolution of ego, which we could probably talk for an hour. Can you just on that before we finish up?
Yeah. And so the third step is that, so you learn to separate from your thoughts, and you've diverted the thoughts. But remember, the mental health word does not look at OCD or obsessive thought patterns as solvable, but they're not addressing the physiology. So you call it anger processing. You learn to turn down the heat. You are diverting thoughts. You do this multiple times a day, every day. It becomes very automatic. Then you move into creativity. So as your brain moves into good food, good wine, good friends, curiosity, gratitude, all these things, your brain actually starts developing this way. And again, my same mentor pointed out, we're all programmed by negativity. Why not program your brain with positivity? Now, you can't do that to compensate for the activated threat physiology. That's a separate skill set. So you're trying to lower threat physiology, then move into creative circuits. As you move into the creative circuits, that's where the healing actually occurs. Again, play is a very profound change in body's physiology.
Yeah.
The final thing about the dissolution of the ego is that this pursuit of self-esteem drives these thought patterns like crazy, and you can't dissolve your ego. You can allow it to dissolve. So what happens, and I don't know where I'm at in this scale, nobody really does know, the beauty about cognitive distortions is they're not real. There's nothing you have to do, right? I just recognize a cognitive distortion. One of them is called mind reading. So I use the word favorite tongue in cheek, one of my most common ones that I can't seem to shake, probably never will. If somebody doesn't call me back in timely manner, I figured I must have done something to irritate them that upset them. So maybe 1 in 100 times is actually true, but they're usually just busy or forget. You know what I mean? But that's
there's so many other things going on in other people's lives than we create the story.
Right. So, and then perfectionism is terrible. The self-critical voice drives all of us absolutely berserk. So again, the 4 parts of healing these thought patterns. And not only do I not have OCD, I don't have those crazy thought patterns I had before I got sick. But I will tell you, I get triggered. One of my nightmares was I decided I was sort of enlightened for a while. I put on a positive label. Mm-hmm. It was the worst thing I ever did because I was suppressing again.
Yeah.
You know what I mean? So
that's why your program is called The Journey. And
right.
Because you're healing along the way every day, moment to moment.
So I wanted to go back to the word forgiveness, why I don't like it. It's fine if you can do it. A lot of things are sort of unforgivable. You don't have, so it sort of implies somehow you're carrying some type of positive feelings towards this person who really harmed you. You don't have to do that. Anger is powerful. It's a physiological state. You simply flip the switch and say, I'm going to calm down my physiology. This person is not my life this minute. Now, again, may come back 10 minutes later. You just you want your brain on the present moment. And thinking about somebody that hurt you in the past doesn't help you do that. So you just flip the switch, because anger is so powerful and so addicting, you never will ever want to give it up. It's a very addicting, powerful emotion. And so when I'm angry, it feels really powerful.
Yeah.
That's the biggest block to healing, by the way, is the inability or unwillingness to give up that power of anger, i.e. pain. So you think that everybody would want to give up their pain. It's not true. Because actually it's powerful. You're entitled. You can ask people to do things for you.
Yeah.
And so even though you're miserable, you can still have a lot of power with it.
Well, we have an entire epidemic going on where these people are in this state, keeping themselves there, obviously, and being treated by an entire system in that way.
But the problem is what happens when you get about mental health issues. Well, the answer is right there in front of us. Calming down through physiology is the answer to mental health. Yeah. Because when you are angry and frustrated, your brain goes from the thinking brain to the survival brain. That's why people do really unpleasant, violent things when they're angry. Anger is a destructive force. It's supposed to be.
Yes.
So the key issue, when we talk about mental health, this is a physiological issue, not, quote, psychological. Again, the psyche in the form of thoughts does happen to be an issue. But again, just get empiric about it. You know, these are thoughts. Here's my emotions. I process thoughts differently. I deal with my emotions differently. So again, the 4 parts, again, thought diversion with expressive writing, cognitive restructuring, and mindfulness. You can increase the resiliency of your nervous system with exercise, diet, sleep, and that's where trauma therapy comes in to help you calm down, not to go into the past and create a trauma story, which keeps you in the victim mode. Then there's ways of breath work, breathing, etc., that help you calm down physiology. It happens all day, becomes automatic, it's not hard. Again, this is not about David Hanscom. Everything we've talked about is well documented.
For thousands of years.
Right.
We're coming up on our time. So can all of our listeners, they can go to the docjourney.com and find out how to heal themselves and go through this journey. So Doc, it is always a pleasure. And I really enjoy these conversations, and we will definitely do more. And if you listeners out there, if you're getting some major pearls of wisdom, which I am for myself and my patients and my friends and family, put some comments below and, let us know what other topics you want us to talk about, because Dr. Hanscom and I we like shucking and jiving on this stuff. So thank you for your time again.
Thank you. I enjoyed this.